This is Dr. Scanamayo reporting to you from elderparentcenter.com, where our mission is always to help you live longer and better. Today we have a very important health topic, and that's the prevention of falls. In fact, 20% of people who fall and break a hip will be dead within 6 months. So obviously this is a very important thing to talk about. The first way we can address this is to look for weakness in the legs. Weakness in the lower extremities can be easily evaluated by looking at a person when they get up from a seated position. If they're using their hands and arms to push off the armrest, this is an indicator that their legs are too weak. They need to have physical therapy. The second thing that we look at is medication. If you're taking more than 4 medications, there is a higher risk of falls. In fact, if you're taking an anti-inflammatory like ibuprofen, a water pill, and a sedative like Xanax, you have a 17 times risk of falling. The third thing that we look at is how steady you are on your feet. If you're wobbly and can't walk in a straight line, this is another indicator that you have a higher risk to fall. A physical therapist can fix this for you. Number 4, dizziness. If you're getting up from a seated position and your blood pressure is dropping, or you're having breakfast and when you get up from the breakfast table your blood pressure drops, this can also cause falls. If it is associated with breakfast, sometimes a cup of coffee during the breakfast can change that. Regardless, the evaluation is a blood pressure machine or cuff to check the blood pressure. And if there is a problem with the blood pressure dropping more than 20 points, you should visit your doctor. The fifth problem is inner ear problems. Inner ear problems are easily assessed by asking your loved one to move their head back and forth. If that causes dizziness, a diagnosis of benign positional vertigo can be made. And again, a physical therapist that specializes in balance training can give you a treatment called the Epley exercises, which can help this situation. Number 6 is we ask people to always go to their doctor and check for infection. Urinary tract infections are very important causes of falls and a lot of complications, very easily diagnosed. Number 7, hand-me-down canes and walkers are very important causes for falls. You should never use a hand-me-down cane or walker. It should only be prescribed by a doctor and fitted by a physical therapist. Number 8, always maximize your vision by visiting a doctor to get proper eyeglasses and contacts to negotiate the home to prevent falls. Number 9, medical problems like urge incontinence, where you need more time to get to the bathroom, or severe anxiety and depression are all associated with falls. Please see my video on urge incontinence to get more information on that. Number 10, the environment. Please Google home safety checklist to get a list of things to look for, including throw rugs, loose cords, and poor lighting that all can be associated with falls. This is Dr. Scanamayo. Thank you for your attention.